In this video, we'll discuss about types of suture knot tying. There are three types: square knot, surgeon knot, and granny knot. First, we'll discuss about square knot. This is your incision site. There are two flap edges, right? So before suturing, you have to use adsense tissue holding forceps to grab the one edge, right? And then you have to pass the needle perpendicular to the tissue. Initially, you have to pass through only one tissue edge. Then you can redirect the needle, right, to enter the or to grab the other side of the tissue edge, right? You can use tissue holding forceps and you have to pull the suture material through the tissues. Then now we have a long end of the suture material and a short end. So in square knot, one throw of the long end of the suture material should be passed through the or around and over the right needle holder in clockwise direction. You got it? Clockwise direction is nothing but in this direction. Anti-clockwise direction is this direction. So first tie should be made in clockwise direction, right? So I will pass this long end of the suture material around and above the needle holder like this, and I have made a loop, right? Then I have to open the needle holder and grasp the small end, right? Then I have to pull through the loop, right? And I have to make a right knot like this. This is the first knot. You can see there is slippage of the knot. That is the disadvantage of square knot, right? So someone has to hold when it slips to make the second tie, right? So this is your first tie, and after that you have to make the second tie in anti-clockwise direction, right? Again I will form a loop in anti-clockwise direction. This is the anti-clockwise direction, and again I have to hold that. This is your second tie, right? And third tie should be made in again clockwise direction like this, right? Like this. So this is all about square knot, and after that you can cut the suture ends. This is about your square knot. Now we'll see about surgeon's knot, right? So there is incision side, two edges are there, right? I will hold one edge with the adsense tissue holding forceps, right? And I will pass perpendicular to the tissues. I will pass through both the edges at once, right? Then you have to pull the suture through the tissues, right? So in surgeon's knot, you should make two throws. This is one throw of the suture material along the needle holder in clockwise direction, and there is second throw like this. So you have to make two throws of the suture material around the needle holder in clockwise direction. Then you have to open the needle holder and grab that small end, right? And you have to make the knot, right? This is your first tie. The advantage of surgeon's knot is because there are two throws of suture material, the tie will not slip. The first tie itself is stabilized, right? That is the advantage of surgeon's knot over the square knot, right? And second tie must be made in the anti-clockwise direction, right? Like this. This is anti-clockwise direction, right? And you have to grab that small end again and you have to make a tie, right? This is the third one. Basically these two ties are enough for surgeon's knot, but for security you can go and make another tie in clockwise direction, right? In clockwise direction like this. You have to make one throw and you have to hold the small end and make the tie, right? This is about surgeon's knot. For understanding purpose you can write like this. The first tie is of 2 throws in clockwise direction and second tie is of 1 throw and anti-clockwise direction. On third tie is again 1 throw but it is in the clockwise direction. This is the surgeon's knot. So in the square knot, first tie is of 1 throw and it is in the clockwise direction, and second tie is also of 1 throw, it is in the anti-clockwise direction, and third tie is again 1 throw in clockwise direction like this, right? So this is about surgeon's knot and square knot. Now we'll see granny knot, right? There is incision site. I will hold with the tissue holding forceps. So I will pass the needle perpendicular to the tissues, right? And I will pull through the tissues, right? So there is long end and short end, right? So first tie should be made in clockwise direction with 1 throw, right? This is the first tie, and second tie also should be made in clockwise direction, right, with only 1 throw, right? And third tie is made in the anti-clockwise direction, right? Anti-clockwise direction with only 1 throw, right? So this is your granny's knot. After that you have to cut, right, like this, right? So what I have done in granny knot, first tie of 1 throw in clockwise direction, second tie is also of 1 throw in clockwise direction, third tie is of 1 throw in anti-clockwise direction, right? If you remember this you can write easily, right? This is all about the suture knot tying types.